Okay, so welcome back to the conversation that I'm having with Zoe Sharp, physiotherapist, about the pelvic floor and all the things that can go wrong and what we need to do to realise that actually we don't have to put up with any annoying leaks or any pelvic pain or anything that might be coming as a result of pelvic floor dysfunction. So welcome again, Zoe. Zoe, do you want to just introduce yourself?
Yeah, so I am Zoe and I am a physiotherapist and I work mainly in musculoskeletal health, but I have been in pelvic health for the last 6 months, which I am very passionate about, and that's what brings me here.
Yeah, thank you, Zoe. So if you've had a little listen to the previous couple of conversations, we've talked about the pelvic floor, and Zoe's kind of shown us where that is and everything. What we're going to do today is just talk about what would happen if you did realise, or you know that there are issues with your pelvic floor and you know that you need to get help. What would that help look like? And I think Zoe's just going to help talk us through that journey of where you might start and where it might take you to as well.
So it's very important that if you have any symptoms, whether it's leaking or if you're having any bulging or discomfort in the vagina, that you go to your GP just to get that checked out, and they might give you a little bit of an exam. They might just take your symptoms and they'll hopefully refer you on to any appropriate testing that needs to be done. If that's all fine and it comes back that it is down to the pelvic floor and that's the route that you need to go down, you should hopefully get a referral to a pelvic floor physio if it's appropriate.
Okay. Can I just take you back? You said bulging. What do you mean by bulging?
Yeah, so if in the vagina you feel like there's a bulge there, if there's any heaviness, if there's any discomfort, sometimes that can indicate a prolapse, which can be part of the pelvic floor dysfunction.
Right, okay. And that bulging can be, because I can remember them asking me that question, do you feel any pressure, like bearing down kind of pressure?
Yeah.
But I do know from talking to other women that actually the bladder can come out, can't it, to the outside.
In severe cases it can, yeah.
So that bulging, you need to kind of just be aware of what that might be and what that might look like.
Yeah.
So going to see your GP or healthcare professional, I think I have said before, my journey took 7 years and I was quite late along the line when I decided to do that. I thought, being me, it's just quite typical of me, I can sort this out myself, and I took measures to do that, and I think I did okay. But actually it was the need for a referral was really important, and we do know that the NHS is really kind of strained at the moment, so those appointments can take quite a long time, so it's important to get on those waiting lists, isn't it?
Yeah, it is, absolutely. If you feel like there is any issues, you can go and ask for a pelvic health physio referral. You can ask your GP for that, and if it's appropriate they should do that for you. Or some places you can refer yourself, depends on where you live.
Right.
So
okay.
It's worth asking the route to get there in your particular area.
Yeah, sure. And I think also, I know again from experience that your GP, there's things that there's medications they can give you, aren't there, that can really help with sensitive bladder. So we've got that referral and then you're waiting for your pelvic floor physiotherapy. What can a woman expect to happen when they go along to that appointment?
So before the appointment, you do normally get sent some information about what to expect. So please read the information that they send you, so there's no kind of scares on the day. So they do send you info for what to expect. And also a lot of the time, if you're on the waiting list for a while, they'll send you links to their website or some information on pelvic floor exercises for you to start reading and to kind of just get a bit of a jump start on things whilst you're waiting. So with regards to the assessment itself, we do get quite in depth with the questions that are asked. The more we know, the more we can help you.
Okay.
So that can feel quite personal, but you won't be asked, or you shouldn't be asked, anything that's not important for the management and for your care. So we go into how much you drink, how much you wee, how your bowels are, if they're regular, any constipation, go into your lifestyle, into your medical history. So it's a very thorough appointment, getting into everything. And then if you're comfortable to do so, and it's appropriate to do so, we would do a pelvic floor examination, which can be an internal examination Doesn't have to be, but it can be an internal examination, which will really help guide your management.
Okay, but it doesn't have to be,
Doesn't
because
have to be.
you know, I think often that can be the scary bit.
Yeah.
You know, especially when, you know, a woman's gone along and maybe feel uncomfortable down, you know, down there, and then
Yeah.
suddenly they're met with this stranger, and suddenly it's like, well, can I internally examine you? So you can do that. You can exam without having to do that.
Yeah, so it will be a lot of guidance on pelvic floor exercises. So we can discuss them and we can talk you through them to get the best idea of how your pelvic floor works and give you a really personalized program for your pelvic floor. It is kind of the gold standard to do an internal examination,
Yeah.
but we can also look from the outside to see what the muscles are doing, if what the muscles around it are doing, and it gives us an idea of how it's working from that aspect.
Right, okay. So after you've gone through and you've taken that, you've done your examination, then will you put a program together for the woman to take away and work on? What do you do?
Yeah, so once we've done the assessment and then we've got into kind of everything from a subjective point of view, finding out what your main problems are, finding out what your goals are, then it's more of a team effort to come together with a bit of a plan on what your management will look like, from my advice, from how that's going to fit into your life as
Yeah.
a patient, kind of how we can work together to get where you need to be. So whether that's lots of lifestyle advice, lots of kind of pelvic floor exercises, it's lots of different things that add together to come into your management plan. Not always just pelvic floor exercises. There's lots that come into management.
So really the woman needs to come to that appointment with an open mind, really, about
Yeah.
the things that she may have to do differently, or
Yeah.
might have to change to be able to, you know, manage her situation and to
Absolutely.
improve things
Yeah.
as well. But I suppose the big thing is, Zoe, is not to be afraid.
Yes. Yeah, but it is very normal to be kind of unnerved because you're going to, like you say, to a stranger, to a health professional. You're probably not really aware of what a physio does, let alone what a pelvic floor physio does. You're not always expecting an examination. So when someone gets kind of a pelvis out like this and starts talking through, it's not always a comfortable situation for someone who's not really talked about it with anyone else.
Yeah.
But every pelvic health physio that I know does their best to make everyone feel comfortable and just work with you in any way that you need and give you the different options of what treatment and management will look like, so you're comfortable with how that treatment will go.
Yeah. And I suppose, does that come back to sort of what's the goal? What is it that the woman wants to achieve from this? Because I think we said that in the previous conversation around, you know, what's good for one person might not be for another. So, you know, your expectations as a physio is to help them to get where they want to get to, as best that you can get them, I suppose, there.
Yeah, exactly.
You know?
And some ladies just want to be able to go out for coffee with their friends and not have to worry about where the toilet is.
Yeah.
Some people want to be able to manage a drive without having to plan 4 different toilet stops. You want to run an awful long distance. Some people just want to get on the bouncy castle with their kids.
Yeah. And they're all really, really just different things for different people, but all really important
Really
things.
important,
Really
absolutely.
important.
And every goal is important if it's important to you.
Yeah, I mean, for me, working with the cohort of women that I work with, I just want to see women getting stronger, feeling healthier, know, and I do know that pelvic floor, leaks and frequency, urgency, those sort of things really stop women from doing the things that they love. And social interaction, social connection, we know is so important for well-being, for mental health, so it's not just about physical, is it? It's about how mentally this affects people as well, and their relationships and that as well. How long will an appointment with you last? If someone came to you, how long do you think they need to spend with you?
So most appointments probably 45 minutes if you're in the NHS. Shorter or longer, it depends on how much you need to talk about and how much you need to go into, but I think an average appointment, the first time you're seeing someone, you're looking at about 45 minutes. That might be longer if you're seeing someone privately, because they can manage their own time differently, but in the NHS you're looking at about 45 minutes.
And follow-ups and reviews?
Probably 30 minutes might be the standard. Again, it depends on kind of which area you're at, but 30 minutes. You'd be
And do you
looking at.
have a set amount of times that you're allowed to see someone, or would you, you know, in the NHS, would they just come back as many times as it takes until?
I think that's dependent on where you are.
Right, okay.
Yeah, so I can't really speak for other areas.
Right,
but
okay.
it depends on kind of waiting lists and where you are, and
Yeah.
different places have different things
Yeah,
that they
but
need to
a
stick
woman
to.
could expect to come into that appointment and be guided and helped to get to their goal. I
Yeah,
suppose.
absolutely. And I think follow-ups are always a necessity, because if we give you some information you take away from it, you might not always fully take away what we're trying to get across in the first time. You only take in, I think, 10% or something of the information that a healthcare professional gives you.
Yeah.
And also, it's not one size fits all. So it might be that you need to come back and we need to change something, tailor it slightly differently to make it work for you, explain things differently. So follow-ups should be helpful.
Yeah.
And hopefully you should be offered follow-ups.
Yeah, brilliant. Okay, well, I hope that that's given you an indication or a good guidance on what you know, might happen if you did go forward and get a referral, but also really understanding that first step to getting into the NHS, getting things sorted, getting even looked at and making a plan, it's really going and seeing your healthcare professional from the very, very beginning.
Go and see your GP.
Yeah, don't be afraid to do that, because that could be the start of, you know, so many good things happening and, you know, so many improvements as well. Okay, Zoe and I will be back. We'll be back for another conversation very, very soon.